Hi, Mark Rogers here. You know, I've been helping retirees close to 20 years, and over the course of time, why it's been interesting to see that information is getting to be more scarce, more than ever. Getting information is getting to be a big deal. And I thought, let's create a new innovative way to share information, particularly around Medicare at this time of the year. For some of you, there might be some big decisions to be had coming up here. There is a lot of decisions that a lot of people have to make during this time from October 15th through December 7th. So what I've done is I've created a private Zoom link that is going to go up here in about 15 minutes or so, and it's a private room, but I'm going to share a little bit more. First, I want to share some ideas on what is going on here, because the fact that people are not catching the true changes that are happening here. I got over here on, let me just bring this up here. I'm kind of running this all. I got this over here at Investopedia, 9 major Medicare changes. This is dated September 9th. And interesting enough, you get down here to number 9, and you may not be able to read that on the screen. I may try to enhance it a little bit more. Medicare, number 9, Medicare Advantage plans must examine the impact of prior authorizations. And it says almost all Medicare Advantage enrollees must get prior authorization for higher cost services to manage healthcare usage and lower costs. Denials for coverage have risen in recent years. And although most denials are overturned on appeal, the vast majority, 9 out of 10, are not repealed. These prior authorization requests, requirements, and burdensome process impose barriers and delay care. And so I thought, if you're in a Medicare Advantage plan, just recognize that the whole approval process is going to get tighter and tighter as we go along. And so for a lot of Americans, why that is getting to be a pain, specifically for those of us that are actually in rural settings. And, as you know, some people actually right now, their Medicare Advantage plan is leaving their county. It could be anywhere across the United States. There are Medicare Advantage plans leaving the county. And during this time, you do have an opportunity to really get a hold of and plan effectively for the future. There's some unique provisions there that Medicare allows that I'm a big believer in. I've helped many people before. So with that, can't share everything here, but I want to share with you quickly here this Zoom room. What's just going to happen here at the top of the hour here at 11 o'clock PST. I'll open up a Zoom, and you can reach that by going over to myhouseofhealthcare.com/Zoom. All right. Now I'm going to go over here, and I'll go ahead and type this in. You should get it over if you're watching this here. myhouseofhealthcare.com/office. And so you'll see that appearing over in your chat as well. All right. Join me. It is private, meaning that I only speak with you one-on-one. No one else can hear. And so I have decided that in this age of lack of information in many areas, and I won't go into the reasons why I know the information is becoming scarcer to get a hold of, is maybe perhaps we can meet virtually. And so I'm happy to share with you one-on-one on that. You can also, if you have the Zoom app, or if you know how to use Zoom or something like that, I do have that up on the screen as well. You can actually call in as well. The phone number is on the screen there. You can call in that number. There's an ID number and a passcode. And so I am speaking to other people individually one-on-one, and I'll have it open for, probably about 30 minutes or so. We'll see how it goes. Actually, I have an appointment here in 30 minutes at 11:30 myself. So I just wanted to make sure and get this out to you that you do have the ability to jump on privately and jump into the Zoom. We're running this every day, every weekday, absent the holidays here in November. Okay, so I want to make sure that you have that ability to speak to someone directly. I can't answer all the questions because of all this rules and regulations that are going on, but I can guide you, and we can certainly look in the Medicare and You book too to find those answers as well. Just a little bit about myself. I have been a licensed agent for almost 20 years now, particularly helping rural folks across the Northwest, and it's been a privilege of mine. And so if you jump over to myhouseofhealthcare.com, you'll find out I have a fellow agent. Her name is Leith. She's standing by as well. You can also set a calendar piece over there if you want, over at myhouseofhealthcare.com. If you say, hey, you know what, Mark, I don't know how to use Zoom, then just set 30 minutes on the calendar. It's real quick. Just click the button, enter your information. I'll call you at the time that works for us. Okay, so that's that. That's what's going on over here on the crazy Medicare window. I call it the House of Healthcare. There's many expenses that are coming down, are surprising people. I'll disclose more of that as we go along, but I thought I'd just share with you that one change for 2025 that has to do with Investopedia bringing this up, that there is a change in terms of when it comes to the specialist care. A lot more red tape going on, and so there's ways to get out of that. And so I wanted to make sure that you had the ability to see what options you have right now. And by doing that, either hit me up on the Zoom, hit me up over in the Zoom room, and or what you can find right here over on the site here, myhouseofhealthcare.com/office, or over on that same page, you can also myhouseofhealthcare.com, set an appointment. Okay, all with that, we'll sign off. I'll be jumping over into the Zoom room here in a few minutes, and hope to see you over there. Love to chat a little bit. And you take care. Let's make sure you make sure your health care is affordable, gives you the most freedom, and sustainable. It's a big